Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call her Brian of Tarth. Brian is an 82-year-old lady who's had numerous earwax removals before, especially in the right ear, the ear that you're seeing on screen right now. It is quite a bendy and narrow ear canal, especially at the entrance. This ear isn't completely blocked up. There's an obvious gap in the middle of the blockage, but it feels very blocking to her. Here I begin with the suction probe. You can see it's quite difficult to get a good angle because of the narrow opening, but I managed to get a hold of the wax and there is some movement here as I'm gently trying to lift it out. There is some oil on the endoscope lens here, but I'm carrying on as I still have a good view. And also as I retreat, some of the oil seems to be pushed to the side, so I have a better view. And here we have our first part of the extraction. A quick camera lens clean and I have my first stills of the wax removed. Back in and we have some drier pieces of keratin and wax mixed together, which decides to swiftly exit by going straight into the tube. And some more keratin here. This isn't too noisy at the moment, so there's no clarinetting going on, hence why I'm carrying on with the larger Zollner. I'm using a motion of suction and then slightly moving the end of the Zollner to the side in a quick motion to get the keratin to separate at the natural point that it's ready to come off. Some bits remaining here, translucent pieces of keratin which come off relatively easy, and I'm back to the translucent keratin on the right hand side which comes off nicely with a little more trying. Here again, and it finally comes off. Here I'm using a fine end to reduce any chance of that horrible clarineting sound. Here's the final shot of the eardrum. In the main, a normal looking eardrum, but there are a couple of areas here and here which look a little thin and unusual. Brian of Tarth has had many operations on her ears, and although she can't remember which ear, this is not the ear that she's had an operation on. So here's the left side, and this ear is definitely the ear which has been operated on. Lots of scarring on the eardrum, tympanous sclerosis, where the skin of the eardrum has become thickened and yellow as part of the healing process. And here on the side we have this chunk of wax which isn't blocking the ear canal, but certainly is affecting how well her hearing aids are working. In I go with the Zollner, and the chunk of wax is really quite stuck to the side of the ear canal wall. likely because of the dryness and the fact that it's attached to the skin of the ear canal and also the wax itself. So there is lots of tugging, and I'm turning the blockage around to find an area where the probe will hold onto the wax. And here the dry wax has broken off and gone into the tube. Lots of circular movements again, which finally release the blockage, and it still needs a bit more help to get it out, but here it is finally free. You can see just how dry the keratin is because of the yellow-white appearance of the skin on the right-hand side of the screen, with lots of little hairs stuck in it too. Some remaining bits of clear keratin around the edges here, which I will remove as much as possible. It's important for this patient that I get off as much of this as possible, because it eventually ends up making up a large amount of the blockage in her ear. But you can see here there is some pink raw skin being revealed underneath, so I'm not going to go too far with this skin pull, and the skin pull naturally breaks off here. And this procedure is complete. We have a very happy patient who can now hear well from her hearing devices. I have the following question from my previous episode of Wax Off from my lovely viewer here, subscriber Joy H. Rusker 9377. Do people ever say that the loose hair in their ears itch? Generally, I would say no. I haven't had any patients complain that the hairs in their ears makes them itch. You tend to get itchiness when there is an infection or things like dry skin, psoriasis, eczema in the ear. Also, people tend to get itchy ears when they've used the dreaded Q-tip or cotton earbud, which removes the natural oils that we produce in our ears, so don't use those. It's a wrap up for this week. A big thank you for everyone watching my video today, especially for my regular viewers who return week in, week out. Please check out my video from last week here if you haven't seen it. It's a good one with some unusual hair patterns in the inside of the ear, which I think you might like. Please keep subscribing, liking and sharing my videos. It's peace out from me, and I will see you in the next one.